422-1212 or text 23680.
Must be that time, and nothing's starting the way it's supposed to. I love a day like that, you know what I mean? Hey, everybody, there it is. It's that catchy
Right
little
on
finger-popping music. We on, as Linda, our phone operator, said in the other room. We is live. Hi, welcome to Stages of Life Radio, brought to you by Stages of Life Medical Institute in beautiful Longwood, Florida. Also, Florida Laboratory Analysis up there in St. Augustine. Is that correct?
Yeah, and Jacksonville, as it turns out. And Jacksonville.
Wow. Okay, so we are on part 3 of our nutritional supplement series. This time we're going to talk about the difference between the genders.
Yeah. Yeah, why not? Okay, you know, it's like anything else around here. Stages of life, stages of health. Well, part of the stage of life is getting older.
Yeah.
So what we've done is we've talked about what's common to everybody. You know, what are the sorts of things that we need to do for everybody's needs? That would be, you know, the exception perhaps of infants. Vitamins, minerals, essential fatty acids, amino acids, essential carbohydrates, and whatnot. These are the sorts of things that we need to take in order to stay healthy. We've had a lot of function, a lot of focus, a lot of attention placed on our immune system. Well, you know, we're all now experts in the immune system because we've got this coronavirus thing going on, and now everybody, in spite of the fact that they may not have even taken high school science, is now an expert, as it turns out, in the immune system. Not even having a clue as to what the basics are all about, but they do their research. They do their Google search. They'll check their Instagrams. They'll look at all the products that are popping around out there, and they'll even pay attention to the CDC's latest recommendation, which, by the way, is the 3rd iteration or the 10th iteration of being different from what it was.
It's not iteration, it's contradiction.
Yeah,
Same word.
Keeps going on and on and on. But truth remains.
Okay.
That which is true to begin with will be true at the end.
Weird.
That is the way that it goes, in spite of whatever misconceptions may be out there. What I am not going to do is waste a great deal of time and attention trying to convince anybody right now as to the wisdom of getting an inoculation and saving your life. It's just the way it goes. Right now, we are on the tail end of the death cycle of this particular virus. You know, we're going to see that we've seen people die. They've come, they've gone. Big chunks of people's families have walked away into the next world. God bless them. I hope that they're happy that they've done so. So what we're looking at here is what can you do to protect yourself? Why? Okay, because the body isn't just an immune system with 2 legs, eyes, and a heart that pump blood around so that it can walk from here to there. The immune system is the shell. It's the thinnest of all shells that protect us from the outside. It's the atmosphere protecting the earth from space. It is a complex part of our body, and it's one of the most easily damaged, and it's certainly one of the least well understood. But what it needs to be nurtured. It needs to be fed. It needs to be coddled. It needs to be taken seriously. But it's not just a static sort of an organ system. It's highly dynamic, and it's extraordinarily complex, and wouldn't you know it, it's not all that easily understood by the average person or even the complex, highly educated individuals, because there is so much to know and so little that's known. So the things that are common to us, we've gone over. Stage 1. Stage 2, we discussed as well. You know, what are the sorts of things that you need to do to deal with the sorts of illnesses that are likely to occur in middle age. Now what we're going to do is we're going to talk about gender differences between men and women. And the whole purpose to this is to be able to get people used to the idea that we're going to start a program to be able to have people take care of themselves. It's a do-it-yourself world. The problem is that anybody can buy boards and nails, but you can't build a deck. Anybody can go buy cinder block and cement, but not necessarily properly build a foundation, although they're happy to sell you the stuff at the hardware store and snicker as you take the stuff home without a clue as to what you're planning to do. Happily, you know, you sometimes have to get past, the permitting departments, okay? So at some point you're not going to kill anybody else, but sometimes you do. So what are we going to talk about? The differences between women and men. So let's start with women. So we've discussed how estrogen levels decrease with age, and this shouldn't come as a huge shock to anybody. As women get older, their estrogen levels decrease. Now, sure enough, they go up and down, up and down, up and down with menstrual cycles. But after the age of 30 or so, the average estrogen level decreases with age, and it does so substantially. It tapers off, and then falls off the cliff. What results? Weight goes up, thyroid function goes down. Bone density begins to suffer. What does that mean? It means that osteoporosis in women begins when they're in their 30s and 40s. It doesn't start to get measured. It doesn't really become an issue, so to speak, on the medical chart until they hit their 40s, 50s, but usually 60s. But it starts someplace, and the place that it starts is in the 30s. Cholesterol and triglycerides, those go up early. Well, it's okay, a little bit of cholesterol, this, a lot of triglycerides, that. And we can give you a statin. We can give you all kinds of things, medications, poisons many, that will lower the cholesterol and lower the triglycerides, but not fix the underlying problem. So what is it? The sorts of diagnoses that then start to develop in women: hypertension, prediabetes, depression. We can add to that. Perhaps we can add libido issues dropping off. We can add depression, constipation, insomnia. I mean, what happens is you start to feel lousy. And that's just the way that it works. Is this predictable? The answer is yes. Is it something that you can anticipate? The answer is yes. And is it something that you can prevent? The answer is yes. You got to know what to do. And you can't tell the players without a program. All right? It's no different here than it is in the stadium. You can't tell the players without a program. Get your programs here. Well, we're starting a program, wouldn't you know? Well, what about men? Let's not forget the guys. Okay, they're the great forgotten gender. The guys that are running around out there. Well, wouldn't you know, estrogen levels increase with age. Okay. So pretty soon you're looking at, what type of dust ruffles you're going to put on the bed. Maybe let's throw a few more pillows on there, curtains. Let's look at the wallpaper. And we're going to deal with, let's say, afternoon drama, these sorts of TV episodes, days of your life, and this kind of nonsense. So estrogens go up, guys change. Testosterone levels degrade. They drop consistently. It's kind of neat. It's kind of like just as the sands of the hourglass, so are the days of your life, and so is your testosterone level. It drops as the sands of the hourglass. So how does this manifest? Well, the first thing that happens is guys start urinating at night. They get up once. Okay, that's not such a big problem. They get up once to pee. It must have been that beer. It could have been the water. It could have been the tea. It could have been my nerves. Who knows what it is? And they start getting up at night. And then they start getting up twice a night. Then sometimes 3 times a night. And then all of a sudden, they start to realize that they're not hitting deep enough plane to sleep. Doesn't necessarily manifest to them that way because they don't really miss the dreams. Erectile dysfunction, depression. And then the alcohol intake tends to go up, and the weight goes up, cholesterol goes up, triglycerides go up, and they have all the same problems that the women have, but for a different reason. So what are the diagnoses? All the same. Hypertension, prediabetes, depression, insomnia, constipation. The only thing they don't get is heavy irregular menstruation, although they do in fact suffer with it just as their wives do. Because everybody's unhappy if the old lady's unhappy.
That's true.
So what is it all about? So the problem sometimes is complicated by this. They go to see somebody with an MD after them or a DO, and they get the treatment for the depression because after all, that's the problem now. You're depressed, so we're going to treat the depression.
But that's
the medication decreases the libido. It does all kinds of other issues.
Kills your libido.
The treatment of cholesterol makes the ED worse. The hypertension worsens fatigue, ED, and some of the other stuff.
So much coming up. You're going to learn.
We're going to
here.
Do this when we get back from these announcements.
That's a true story. Support our sponsors like Pharmacy Specialists right there in Maitland, a compounding pharmacy that Dr. Klein has worked with for the last couple of decades. They really have it going on.
35 years.
Yeah, 35 years. Okay. Check them out at makerx.com. Be right back. So we got some questions. Joe says 29-year-old daughter's doc told her to get a B12 1,000 mcgs, which stages of life B12 supplement. Would you recommend? Oh, of course, need it with intrinsic factor. Why is folic acid also needed? What?
Okay, you put the folic acid in the B12 just a little bit because there's a theoretical concern that taking B12 in excess can hide a folic acid deficiency. And the joke is the same thing is true with folic acid. It should always contain a little bit of B12 to prevent a theoretical concern, which, by the way, in 35 years I've never seen, but it doesn't mean that it can't occur. So we include it in each of those two products because of that purpose. For 29-year-olds, I would use the Turbo B12 because she really doesn't need the intrinsic factor or the betaine. It won't be necessary because it's unlikely that she has an elderly stomach, let's say. Now, on the other hand, if the 29-year-old daughter had issues, let's say, from bariatric surgery, then the answer is you would get the bioenhanced. If she ended up having things like lupus and some of these other autoimmune disorders, then the bioenhanced is a better product. So it really depends on what's causing the B12 deficiency, and you have to figure out why. If it's just because she doesn't like eating Bambi, okay, she is not, let's say she's a vegetarian, then Turbo B12 will work just fine. So it really does matter what the situation is. Yeah. But statistically, the most likely benefit would come from the Turbo B12.
I wish we had time to answer this one about sweet potatoes with drawers on them.
Yeah, I like it.
I'm not really sure where that's going, but yeah, I mean, no shirt, no shoes, no service, but it's a sweet potato. So if it's wearing drawers, I guess I'm all right with that.
But Sarah Grace has got an interesting question.
Yeah,
we'll catch that on
We're
the
going to catch that on the air.
Yeah.
We can do that one on the air. About 10 seconds here till we come back to the Radidio.
The Radidio?
Yeah.
The ADO ray.
Uh-huh. That's right. Welcome back. Stages of Life Radio. That's us right here, Dr. David Klein. He's got so many board certifications, we had to build a new wall just to hang them.
Well, it got to be too many letters after my name. It started looking like something on the Three Stooges.
It's like a weird anagram at a certain point. I'm like, what does that spell? Anyway.
Smells studied too much.
Yeah. We're going to take your calls in just a second. They're already lining up at 407-422-1212. And we also have the text line always open for you at 23680. And if you're lucky enough to be watching us on Facebook, Twitch, Periscope, or any of the other platforms, I can't remember them all, YouTube, you can always see us. I know.
That's scary, isn't it? Yeah.
But anyway, before the break, Klein was talking about the doctor was in. We're talking about the gender differences between nutritional supplements and the things that can go sideways and how to fix them.
Well, yeah, one of these sorts of days, okay, somebody's going to need to talk to you about the difference between boys and girls. And there's some very, very real hormonal differences, for better or worse. The French may say vive la différence. Sometimes in medicine, we go the other way with it. It's kind of like, my God, it's complicated enough, then we have to deal with that.
Okay.
So what do we do about this? Okay, so we will knowingly and assertively go ahead and change the regimens for men and women ever so slightly. This is done because you have to assume that men and women are going to be physiologically different enough in a predictable manner that you could take a few extra steps, a little deep breath, and fly with it. So the first thing we're going to do is deal with women. So as we get older, as women get older, the adrenal glands have a tendency to become more and more dominant a feature with regards to hormonal balance. The gonads, the ovaries, tend to they fall apart, let's say, after so many decades of abuse. They begin the first time that you have a period, they scatter, they shatter, they shotgun a bunch of eggs out there. One usually makes it through the cycle, and either you get pregnant or you don't that cycle, and each month you blow through a bunch of eggs, and the number diminishes with time. And it's when that number goes to zero that you reach menopause. It's not when you feel like going through it. It's not a matter of convenience or inconvenience. Sometimes thyroid will go down. Let's say you become hypothyroid, and it can look like you're menopausal and still be very, very fertile. Well, gee, I don't understand what it was. I hadn't had a period in so many years, and now I'm a 42-year-old female with a baby. And the answer is because the adrenal function actually is substituting for a good bit of the progesterone and the estrogen that's being secreted. And when you do ovulate, you may not even necessarily see a change in the uterus. Well, boom, there you go. And you end up with a baby. So we typically start by treating the adrenals. This is done with several medications. One we use is called Adrenal, or A-DRENALL. There are any number of adrenal preparations that you can use. The reason why you start with an adrenal glandular supplement, okay, is that there are over 150 hormones that are secreted by the adrenals. About 8 of them are important enough to focus on or measure, but then there are a whole bunch of intermediaries which have functions that we may not necessarily understand fully. Doesn't mean that we don't know what they do. So like the thyroid, well, the thyroid kicks out thyroid hormone and calcitonin, and, well, if you grind it all up into one piece, parathyroid, but wouldn't you know? There's T4, T3, T2, and T1. So most doctors know about T4 and T3, or at least they should. Mm-hmm. They don't necessarily know about T2 and T1 and their function. And they do have function in human physiology. Yeah. So if you're only looking at one thing, you are likely to miss the other 3. So adrenal glandular medications are very, very beneficial. And sometimes this one stupid little step can restore a person back to a prior state of good attitude, because the adrenals aren't all about breakfast anymore. The story with adrenals, okay.
I see what you did
there. I gotcha. Mm-hmm. The adrenals actually are important with regards to the entirety of your circulation, your body's ability to function, your brain's ability to think, and whatnot. So we use these glandulars, DHEA, dihydroepiandrosterone, not to be confused with DHA or docosahexaenoic acid. So these abbreviations are best used by professionals because they will get you into trouble if you're not careful. Well, gee, doc, I thought you said I needed DHA. And then you go take DHEA and you're going to end up growing a beard. And, so you have to be careful what you do. And in women, the stuff is taken in very low dose, because a 25 milligram dosage of DHEA is very much like 50 to 100 milligrams to a guy. You go to the drugstore, buy this stuff, they don't really care. They'll sell you one bottle of the other. It doesn't really make any difference. So you've got to know what you're doing. Vitamin K2 and Strontium. Vitamin D3. Now, you're going to be taking D3 anyway by this point because it reduces your risk of cancer. But why vitamin K2 and Strontium when you hit 30 years of age? Because this is when bone issues begin. Osteoporosis begins in the 30s, usually mid to late 30s, but it can happen earlier. Do you want to be late for that bus? The answer is no. So for just a couple dollars a month, you can prevent an awful lot of aggravation. Osteoporosis is not a lot of fun when your bones start to break, and it happens when you're in your 60s. Are there things you can do to speed it up? The answer is yes. We can get into those a little bit later. We typically add an additional 50% dosage of minerals to women in their 30s to 60s. So, yeah, you're taking down to basics, but then we add a half dosage of magic minerals. It seems to work, and it seems to do so very inexpensively. To deal with those sorts of issues of a domestic nature, libido, it's kind of an important thing.
Sort of.
Tribulus terrestris is something that you can add, and that will gently bump up testosterone and make women feel a little bit better. Now, mind you, none of these things involve prescriptions thus far. It's a whole lot easier to understand what you can do yourself before you start calling in some yahoo to start making changes in your hormone levels. But that's going to be necessary by this point. And then to treat the triglycerides and cholesterol, which if you were taking the folic acid, you're well on your way to controlling it. If you were taking the N-acetylcysteine, you'd be well on the way to taking it. So by this point, you'd be taking berberine for the triglycerides and the prediabetes. Now, okay, so all of these pieces are falling together, or should be falling together, like so many pieces of a jigsaw puzzle. And in case you're worrying about men, okay, for whatever reason, okay, we typically do the same thing, but we operate in sort of an upside-down basis through the age of 60. Stud mix gently raises testosterone, lowers estrogen, and helps you sleep at night by dropping the estrogen level and shrinking the prostate back. To that, we add beta-sitosterol for the prostatitis that hits 1/3 of all men. Usually occurs as a result of chronic prostate infection. Again, that's a pretty substantial number of people. And then Tribulus again. Why? Because Tribulus is more gentle on the system and a whole lot less expensive than things like Viagra to lower the cholesterol. Now, here's where men and women differ very substantially. Silymarin, milk thistle, and curcumin. Now, why don't we do this in women? Because the silymarin will lower cholesterol. Sure enough, it will lower triglycerides marvelously. It will clear out the gallbladder famously, but it will lower estrogen dramatically and make everybody a whole lot less happy. You can lower your cholesterol and then just end up with somebody who needs to be, let's just say, discharged with a wooden mallet and a stake. So silymarin and curcumin for men. And then again, same thing, berberine and triglycerides for the pre-diabetes. What do you do about the things like hypertension? Okay, antihypertensives, if chosen properly and gently, shouldn't have any great effect on a person's psyche or on their libido. They shouldn't be that difficult to take. So you want to get out there and let the doc do his or her job. Now, there's some things that you can take. Hibiscus tea is one of my favorite things to control blood pressure. Sesame oil will control it. But for the most part, it's cheaper, more predictable, and easier just to take a couple tenths of a milligram of clonidine, and that usually does the job. And the worst thing it'll do is it'll help you if you have any pain issues. So that, as Forrest Gump said, is all I got to say about that. And so what we're doing is we're going to make these things available to folks on a subscription basis. I haven't really done it entirely yet because I'm not done with you. I still have another couple issues to go by.
Oh, yeah.
One of which is going to be disease state, and the last of which is going to be disease proclivity. Now, why do you care about this? Because if you're going to do it yourself, you do it right. If you're going to study this, you study it properly and thoroughly. And if I'm going to help you, I'm going to make sure that my name is on it and it's not going to be used improperly.
There we go.
Now we're ready to take calls.
Which means we have about a minute and a half, maybe two. Let's see if we can get Bob in here.
Yeah, Bob? Why is Bob smiling?
No, that's Tom.
Oh, it's a different Bob.
That is Tom. Hey, Bob. Bob from Apopka's on the horn.
Yeah, hey.
Hey, Bob.
Let's see. There we go, I think.
How you doing?
Well, we're still, hang on, we're still
there?
trying. Now we've got you. All right, what's up?
Okay. My question is, I contracted the virus in the end of July and got over it. And I asked my doctor recently to get a antibody level test,
Yeah,
and he said no. He said no, it's too unreliable.
okay.
He wanted me to get a vaccine.
Okay,
So,
yeah.
did I look for a new doctor?
No, just look for one that has a little bit more common sense. It's very, very difficult right now to find family doctors of any capability.
That's true.
All right? So don't throw somebody away because they don't know something that you do know. Now, here's the moral of the story. Number one, the antibody levels are highly reliable. You just need to know how to interpret them. If you have it done by the big box folks, you're going to get a level back and they're not going to give you an interpretation because they don't have a doctor attached to their laboratory as we do at Stages of Life. So my patients, they come in, they get the bloods drawn, they get a level, I interpret it. So the commercial laboratories do not interpret anything. What they do is they give you a number, and then it's up to the doctor that you've got to do it. And if that doctor doesn't understand what they're looking at, that's where the problem is. And we're going to come back to this because this is just extraordinarily important.
Well, we have some other questions, too, about the monoclonal antibodies, Regeneron, Rejuvenate, who knows? It's all kinds.
Remdesivir. We'll get all that stuff, but let's finish up with this youngster.
Well, we will finish
because
the
he's got the question.
It's a good question. It really is. All right, so we're going to just take a quick break. We'll answer the rest of that question on the other side of these commercials. Support our sponsors if you would. Melissa Fox, along with Dr. David Klein, Stages of Life Medical Institute.com for more information. Yay, it's getting very warm in here. Is it just me?
It's you.
It's me. Damn it.
No, it's getting warm in here.
Okay.
Yeah,
I
but
hate when you do that to me.
it's okay.
All right,
you have
so-
all this equipment that's generating heat.
I know, and lights and stuff. Sarah Grace is watching us on Facebook. Hi, along with a bunch of other people. We've got we're on like 8 different platforms right now. Should immunocompromised individuals receive monthly monoclonal antibodies injections?
No, not at all. I mean, the first thing you need to understand about monoclonals, okay, is that they're not without their risk. You just need to look at where they obtain the monoclonal antibodies and look around your neighborhood because they're coming from other individuals just like you. So as with any other blood products, there's certain risks that are attached to it. So I wouldn't have somebody say, well, gee, we're going to prophylactically give you a platelet infusion or a red cell infusion or any other type of infusion. Let your body do its job. But there are very, very few immunocompromised states, diseases, that don't generate your own antibodies to this. So the real deal here is get the vaccine. The vaccine is going to give you 30 micrograms of the RNA. It's going to generate a substantial immunoglobulin load that you're going to make yourself without the risks attached to it. Why people don't understand. So they'll go out and they'll get these infusions, which, by the way, when the government stops paying for these things, if you're willing to pay a couple grand a pop for it, I think you would probably think differently.
Well, it's equity now for the government.
Yeah, now. Yeah.
Here's the thing.
No.
And I just did a segment on the Florida Roundtable with blood cancer doctors.
Yeah.
They did not get tested in the original test group, but the data's been, people, they still went and got it anyway, a lot of them, in the American Cancer Society and the LLS. They put it all together, and they said, please get the shot.
Yeah.
Even if you got blood cancer, whether you're in remission or whatever. So, again, they're coming out more and more saying, look, it's really beneficial.
Yeah, the upshot of it is that there's an awful lot of really, really goofy press that's out there. Well, you're going to get sick and you can die and you're going to end up, your head's going to fall off. And 3 years from now, you're going to turn green because Bill Gates wants that to happen.
My cousin's friend in Trinidad's balls swelled up.
There you go. I mean, there's so many of these things.
It was a big thing.
It makes no sense. If something sounds stupid and unlikely, it probably is. So get the shot, be done with it. Now, to get back to our youngster Napopka, okay, so his doc, we're going to catch him momentarily.
Yeah,
the temptation is just
anyway,
to jump
Sarah,
on it.
again, those monoclonal injections, first of all, shouldn't be getting them that much, and second, the government's only going to pay for them for so long.
And the risk attached would make absolutely no sense. So if you're going to go ahead and have somebody dump a bunch of blood product into you because you're unwilling to get a shot, that makes no sense whatsoever.
Not at all. Welcome back. It's Stages of Life Radio every Sunday afternoon, live from 4 until 5 p.m. And replays are available not only on the Stages of Life Medical Institute Facebook page and others, but you can also get them on the podcast, on the iHeartRadio podcast. Just look for Stages of Life Radio with Dr. Klein. And right now, the doctor is in. The phone lines are open, 407-422-1212. And the text line is deader than a doorknob. What happened? Is this thing working?
Well, it must be the Olympics.
23680. It's the Ryder Cup.
The Ryder Cup?
Yeah.
Yeah, I don't know. Somebody has to, whatever it is.
Someone's playing golf.
Somebody's playing golf, yeah.
All right.
They'll be bored to death. They'll be back shortly. We'll bore them even more.
Before the break, Bob checked in from Apopka, and he went to his doctor, and his doctor was like, don't bother with the antibodies test. Just go ahead and get the shot.
Yeah. Well, he's right about just getting the shot.
Right. But Bob wanted to know if he should dump his doctor, kick him to the curb, and that is not a good idea, especially if you have a history with him.
No, you don't do that.
Some confusing times, right?
Yeah. Look at the baby, look at the bathwater, and don't throw it either at this point. So sometimes you get really, really good advice from a physician, and sometimes you don't, because not every doctor understands what the heck is going on. Antibody levels, the quantitative antibody levels, are extraordinarily valuable if you know how to interpret them.
Right.
That is one of the values of what Stages of Life does, because when we get those values, it automatically chunks out a report. It tells you what it is, what to expect from it, how long they're expected to last for you, and when you should get your vaccine. So here it is. So Bob catches COVID. God bless him. He survives, as I did, my wife did. And what is his antibody level doing? That level is going to dictate when it's going to be safe and comfortable for him to get the vaccine. Now, we have a fellow broadcaster, who ended up with rather low levels of the antibody. And so we checked how things were going. And upon repeat injection, the levels never went up.
But
think about that for a second.
Why would that happen?
Because
is it stagnant?
No, because
situation?
some individuals, 2.5% of the people receiving the vaccine are not going to generate an antibody response. The only way that you know this is by getting the level.
Now, just a sidebar, why would that happen? Maybe health issues, other medication?
This is kind of where the rubber hits the road. Okay, so, could it be things like obesity? Could it be things like diabetes, adrenal failure, testicular failure, nutritional failure. We just did a whole segment, two whole segments actually, on nutrition and why this is important for the immune system. You think taking zinc is going to make any difference? If you're zinc deficient, it might help.
Yeah.
But if you're deficient in magnesium, it will not. If you're deficient in vitamin E, do you think taking vitamin D is going to help? Well, it's not going to help what you think. So wouldn't you know? So 2.5% didn't get it the first time, 2.5% didn't hit the second time. This is the individual that needs to know to stay locked up like Joe Biden.
Right.
Okay, he's the guy that has to pull a Biden basement. You know, now you on the other hand, you got COVID and survived. The implications are that your immune system is good. If your antibody level is excessive, or let's say that not excessive, if it exceeds 5 or 6, and you get the vaccine, you're going to do what happened to me, which is called getting sicker than stink.
Because you got too many antibodies.
Too much antibody, you take the shot, and then wouldn't you know it, down you go. Now, it's a misery for about a day. Okay, is it inconvenient? Yeah. Is it uncomfortable? Yeah. Did I curse myself? Yeah, because I played Florida Man. I knew my antibody level was good.
Dave wanted to see, and sometimes when you're a former military, you already are used to being a pincushion, so you're like, I don't know, let's see, we'll do a little test there, find out for everybody else. Jeff.
Right. Hold my beer and watch this. So, you know, my wife doesn't like me to talk to her about her situation, so I won't name her by name, but the person I sleep with, her antibody level was low. It dropped off. She gets the COVID vaccine. It bounces right back up to where it should be. She does fine. Mine was actually doing okay. She and I both got the shot on the same day. She yawned. Oh, this is okay. I think I'm going to go bowling, you know, and did beautifully with it. And I walked around like I was 110 years old, and I looked considerably older than 110. I was sicker than stink. So get the antibody level done. If it's over 6, you wait until it drops below 6. You know that the degradation is about 50% every 90 days. So if it's at 6, you have between, let's say, 6 and 8 weeks before it's going to go critical. If the level is at 4, you wait 1 month and you just go ahead and fly with it. But if you don't know your level, you can't really make plans. So if you want to, come by Stages of Life and we'll draw it for you. You know, it's one of those kinds of things. If you have Medicare, it's not going to cost you anything. If you have any of the other TRICARE, it may not. Any of the other insurances, if you're a patient, it's $49. If you're not a patient, it means we have to start a chart for you, and it's $199. One way or the other, if you don't do it, that day is worth something.
It kills me. I was just up in Altamont this morning, and of course they've got these COVID rapid testing places. Which,
there we go.
Which are storefront BS. Because they don't, there's nobody medical behind any of it.
Yeah, well, it's kind of interesting. These things are the rapid tests. We'll have the results back to you in 2 days. Now, what does that mean? Okay, that means that somebody's going to give you a stick to shove in your nose, swab around, which, by the way, that's like doing a do-it-yourself catheterization.
Sort of
there are people that can. I'm not one of those people.
Not going to do it.
Not going to work properly, and then they ship it off to the lab to be done. So it's not like there's somebody behind the counter at the Walgreens actually running the Sophia machines, because they're not.
No.
They're being sent to a central lab. The other problem with these particular machines and this type of testing is that it has a sensitivity that's very, very poor. So if you're asymptomatic and you just need to make sure that you're okay before you go talk to grandma, it's not going to pick you up. You have a runny nose, a fever, chills, and a headache, then it's most likely going to pick you up.
Here's an example on a national platform this past Friday.
Now that we're on it, another one, a different national platform.
Different one. No, we're on it. But this different national platform, a television one, with a bunch of annoying hags and magpies. Maybe Joy Behar and a couple of others.
Right.
Anyway, I think the vice president of some country was supposed to be on, and the girls get tested, swabbed and swabbed. Negative, positive. Oh my God, we're positive for COVID. We can't have the vice president on the show. And of course, she laughs with the whole segment anyway, because the border stuff is funny. Anyway, so they kept testing, and after they tested 2 negatives, and then there was positive, negative, and it's like, and they're doing these rapid, weird,
which are really awful.
Yeah, they're horrible.
They are no good. You get exactly what you pay for when you buy those 2 for $25 tests at the corner drugstore.
That's what I'm trying to say.
The number of false positives and false negatives is enormous.
Exactly. So the whole TV. I'm talking on a huge stage here. They're like, oh my God, we just tested negative. Now now we're just positive. Oh, we can't do
Look
this.
at them. Do any of them look like they could pass an intelligence test?
No.
Okay, you just listen to what they have to say, and it should say.
But talk about all the housewives and, et cetera, that are going to be confused now because they can't tell. The one girl's coming on, I think her name's Megan or something or other, but she's on there. She's like, well, I tested negative twice after that. I don't know what to tell you.
Yeah,
I'm like,
because
I
they
do.
don't know what they're talking about.
Don't know what you're reading.
Here we have a doctor out, 4 or 5 miles from where we're sitting right now, right? Who doesn't understand the technology.
True.
I was an analytical chemist, still am actually, before I became a physician. That was very helpful to understand the differences between the technologies, something called, the correlation, of the test numbers that you get and whether or not it's actually true. Standard error, the estimate. What you can look at is the sensitivity. You look at the specificity. These are statistical descriptions of how to use these tests. If something has a 15% or 20% false positive rate a 15 or 20% false negative rate, that's a coin toss.
Why bother?
That's a coin toss. Why not bet your life on I'm going to go to the drugstore pregnancy test? All right? What are the ways how could that possibly go bad?
Sideways, I'm sure.
How could that go bad?
Wow. Okay, Dave, we got a couple of texts, actually. I think it's the text line's working.
Yeah.
This one says, I'm a 67-year-old woman in good health. What basic supplement should I take to maintain good health?
I wish I had written that question. Okay, so first thing you do is you start off with your pedestal products, the things that are not necessarily going to change because of your age. So 1 through 80 years of age, you'd be taking down to basics. The dosage there would be 2 in the morning, 2 in the evening. That is a wraparound product with regards to getting the vast majority of the micronutrients that you need. To this, you would add heart and soul fish oil. It's got the appropriate amount of DHA and EPA for most individuals. Vitamin D3, 5,000 IUs. That gets you started. Hyperfolate, which is folic acid, 5,000 micrograms once a day. You are now taking care of most of the things that you would need through the age of 30. By the time you hit 67, your gastrointestinal tract is not absorbing as well as it did when you were 30. So you would add magic minerals to it. The dosage would be 1 twice a day instead of the 2 that we typically do. N-acetylcysteine, 3 per day, which not only helps clear out and keep your gallbladder clear, it's helpful for thyroid disease, and wouldn't you know it, it's been demonstrated to be preventive and reduce the risk of dying from COVID.
There you go. And
We're
all
not
of these
done.
things can be found. I know we're not done. Hang on there. All these things can be found on stagesoflifevitamins.com. We're going to finish your question. We've got another text about prostate cancer and testosterone and stud mix. And we also have a gal on the line from Kansas City.
Cool.
Who wants to check in. Again, we are all over the
What
place.
was that line from Full Metal Jacket about Kansas City?
Only steers and...
Yes. Very good. Pop culture's positive. You would, we ought to go on Jeopardy.
No, not now. It's a mess. We'll be right back. It's a true story. Jeopardy is a hot flicking mess right now. I don't know if you've noticed that. Well, first they had hired the guy, Mike Richards, that was a producer, and then he apparently said something anti-Semitic years ago, and they were like, "Nope, you're out of here." And now they're splitting it with the guy that won that a million times but has no personality, and Blossom.
Well, I'm surprised that the anti-Semitic statements didn't get him promoted.
I'm just saying.
Yeah.
Okay, so anyway, no questions on there, but questions online. That was cool. Let's see what else. So we have to finish the maintaining the good
I'll
health.
take care of our 67-year-old spry lady who's actually probably younger than I am.
Yeah, and then what about this
And
one?
that
though?
is depressing. Okay, the only cougars that hit on me are in their 80s.
Oh, that's depressing.
That's sad.
That is sad. I can get away with this. Let me see if I can do this. I think I messed
Or
this.
what do we...
Hold on, I'm just mumbling to myself. You just hush. I was going to fix this spot block.
Hey, you look like you're dialing something in.
I am. I'm dialing it in. It won't let me do it, though. Spot block. Modify. No, it says you can't do it. Oh, well, we'll take it.
All right.
I really didn't want to do that, but we will anyway.
This is the nature of live radio.
Live radio, people. Nothing here.
This is not a pre-recorded show, is it?
George, I messed it up.
Here we go. Yeah.
It's not going to let me do it. There we go. Come on.
I've always wanted to be an Indian chief.
Did you?
Yeah.
Cool.
My mom said it was unlikely.
To be cowboys. It's gonna be a minute here. I messed up. Not really. I mean, I sorta. Not really. It's
We have to blame somebody.
a little early. 10 seconds is all. Does NAC have any side effects?
Everything has side effects, and we'll talk about that. That's an easy one.
Yeah, we gotta finish that. Welcome back to Stages of Life Radio. Before the break, we were talking to a 67-year-old woman on the text line who's in good health, and the doc was explaining what basic supplements she should take to maintain good health. Dr. Klein?
And we got it right up to the point where we need to talk about your bone and bone health. So, to the list of things that I gave you earlier, we need to start you on something called vitamin K2 and strontium. Now, assuming everything else is equal, and you're doing fine with whatnot, then we wouldn't necessarily need to do anything with the adrenals, the berberine, or the tribulus. But if you're taking any medications, or if your doctor told you that you should take this, that, or the other, what we just discussed is going to change a little bit. Now, we had a call, or whatever, I guess it's a text, there's something about NAC having any side effects, to the point where Sarah Grace says, does NAC have side effects? And then we didn't answer fast enough, so she wrote it again. Does it cause any side effects? And the long and short of it is everything has side effects.
Everything.
The question is when do you turn a side effect into a good effect? Or a salutary effect is the appropriate phrase. So a side effect of constipation is great. It's a marvelous thing if you have problems with diarrhea. Loose thing of the poop. Diarrhea is a great side effect if it causes that, if you have constipation or constipative issues. So what can NAC do in terms of side effects? It can cause dumping of the gallbladder, which, by the way, if you have gallstones or sludge, is a marvelous thing because you want to clear it out. If you have diabetes, it can rapidly lower your blood pressure. If you have thyroid issues, it can rapidly change the inflammation of the thyroid. Sometimes that causes you to get dizzy. Sometimes it may cause the blood sugar to plummet. These are not problems. It's actually exactly what you'd hope to happen. Okay. So it does, so you have to be careful with it. NAC smells like sulfur dioxide. It's just one of these sorts of things where when you first open it, it smells like rotten eggs.
All right. We got Sharon on the line. Sharon, you there?
Yes, ma'am. How are you today?
I'm great. Checking in from Kansas City. Wants to discuss symptoms.
No, Haines City.
Haines City.
Oh, Haines City.
Oh, we liked you better when you were in Kansas City. Haines City's okay, though. I've been there. All right.
Okay.
All right. Discussing symptoms of after having the antibodies test. What's that all about?
Well, no, I had the antibody test, and then we had the shot. Okay.
Yeah.
My husband's antibody was 1.09, and we did the semi-quantitative.
Okay.
And mine was 2.89. So we went in and got a booster, and like next day after, all we wanted to do was just sleep, and every joint ached.
Yeah. Okay. That is certainly something that you can see with a booster. Imagine that. Imagine feeling sleepy.
This is the boss getting ready to tell you how badly he
Imagine
felt.
just feeling sleepy because my wife and I we went and got our second shingles shot and our influenza shots on Friday, and all day Saturday. Okay. What I got to tell you is that we felt as though we had the flu.
Oh, no.
No coughing, no sneezing, none of that kind of nonsense. But it makes you feel very fatigued and washed out. Your immune system is doing its job. Most of the symptoms that you're going to get from getting the inoculation, if your immune system is working, are going to resemble the sorts of complaints that people have when they get COVID without the bite that's attached to it called death and hospitalization. So if you felt bad for a day or so, congratulations. It means your immune system was kicking in. What I'd suggest that you do is to wait about 5 or 6 weeks after the injection and repeat the quantitative or the semi-quantitative analysis to see what your antibody levels go up to. Mine were down around 6 and they jumped to 42 after 2 weeks.
Too much.
Okay, no, but mine just jacketed upwards. It's just very, very good. That is something that I'd like to see everybody have. If I could share that with you, I would, but your response may be better than mine. So to find out, get the semi-quants, but give it a couple, 3 weeks, and then see where you are with it. It's going to plateau at 6 to 8 weeks. So if you know what it is at 6, repeat it a month afterwards, then you're going to know how long you're going to need to go before you get the 4th injection, because this is going to be with us a long time.
Oh, yeah. Yeah.
And we've talked about it now for the better part of a year and a half. This is not going away anywhere.
I'm getting my flu shot, and I don't know if I'm going to do shingles.
Get the shingles because your insurance is going to cover it. Mine did not. My insurance, which is Medicare, did not cover the shingles vaccine. It's $190 for each, the 1 and 2 doses. My wife, on the other hand, who will remain nameless because after all, she paid nothing. Her Blue Cross covered.
Well, aren't you special?
Yeah.
All right, let's answer this question here. After making it through prostate cancer and having my testosterone levels severely reduced,
you bet,
is it safe to take stud mix or any other testosterone boosting product?
The answer is yeah. You just need to know what your levels are. The testosterone was put there for a reason. So when people get prostate cancer, their testosterone levels are typically very, very low to begin with. Prostate cancer does not occur frequently at all. It's a rarity in young men with high testosterones. It becomes extraordinarily common in old men with low testosterones. So if the testosterone caused the prostate cancer, don't you think that would be reversed? Common sense would suggest that it might. So a low testosterone and a high estrogen is associated with testicular cancer. The estrogen is what causes the stimulation of the prostate, believe it or not. So the stud mix will actually lower the estrogen, which is going to be very, very beneficial with the testicular cancer history. But there are a couple other things I'm going to recommend for you. One of which is to have your doctor start you on something called prazosin or terazosin. These are blood pressure medications. But what do? They actually act as chemo agents with regards to prostate cancer and reduce the risk of reoccurrence. That's easy. The second thing is vitamin D3 reduces your risk of recurrent prostate cancer. So you may or may not be doing these things. If you're not, then I suggest that you get started on it. Prazosin is cheap. I think they just about give it away at Publix.
Elizabeth is watching us on one of our Facebook pages, Stages of Life Medical Institute, I would assume. 60-year-old woman with atherosclerosis. It was as close as I could get. Diabetes and high blood pressure. Had a 3.98 antibody level after 5 months from second Pfizer shot. When should I get a booster? And also, when should I get the flu shot?
Okay, so I wouldn't suggest that you get the booster and the flu shot at the same time. The reason I say that is that the flu shot is going to make you feel pretty crummy, but I can't imagine you wanting to feel more crummy than what's going to happen if you get that booster and you feel badly with it. So we separated ours, and I'm really glad that we did.
Some people, Doc, have had absolutely no issues.
I've got it, but you play
my work buddy's been fine.
You play a statistical game.
Yeah, you do. So
okay, so
takes your chance.
Yeah, you do it, and you pay your chances. But going back to get a flu shot afterwards is not that big a deal. So 3.98 is a level where I would send you in right now to get the booster. So why? Because it's going to drop to 4 by the end of next month. So now would be the time I would roll in. But I wouldn't necessarily get the flu shot at the same time for the same reason why we didn't get it, which is why do you want 2 levels of misery if you're...
I agree, which is why I asked you about flu
more so.
And shingles
okay,
tomorrow.
In terms of what I did right and what I did wrong, getting the shot on a Friday is a really good idea.
I know, that's
because then you can recover on Saturday and not worry about anything. But if you're working or if you have responsibilities during the week, doing it and feeling crummy just is not the way to fly with it.
Guess who's going to do that?
You. I know.
It's always the way it is. It doesn't matter. 407.
Well, that's because you work the weekends.
422-1212. I don't know. We'll have time to take another call at this moment. By the way, keep in mind, folks, as much as we love giving away free advice on the, try to limit it to like maybe once every few weeks if you call the show instead of every Sunday, because other people need a chance to get in there too. We've had a couple. Don't hog the doc. I know it's hard. We love him too.
There you go.
Anyway, for any information about stuff we've covered today and a whole plethora more, check out stagesofliferadio.com. You can listen to the doc until your heart's desire. I'm just saying.
Heck, it makes me bored. Yeah, the Stages of Life Vitamins.com. You can see and read about the stuff that we do here. We have lots and lots of radio segments on there, so you don't even have to sit back and read it. It can be done passively as well. Stages of Life medicalinstitute.com, where you can read about us, learn about us, and if you want to come by and visit us, my God, the door is open Monday through Thursday from 8 until 4.
Bye-bye.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts many insurances and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
You wanna get rich, you got to get out and dig.